My name is Mary Alice Mata, and I will be doing the neuro assessment for the infant. The motor system assessment includes a behavioral assessment for which I will obtain a complete history from the mother while she holds the infant in arms, and at the same time I will be observing for spontaneous motor activity, for symmetry, and for smoothness of movement. Smooth movement indicates intact proper cerebellar function. For screening of gross and fine motor coordination, the use of Denver 2 test with its age-specific developmental milestones is appropriate. While assessing the motor, cerebellar, and reflexes in infants, note whether their presence or their absence is appropriate for the infant's age. Clues are always found during the physical assessment, so I will observe for the infant's alertness, the faces he makes. I will be observing for low-set ears, or for port wine stains, indicating a neurological or congenital condition. If he's asleep, slowly awaken the infant with touch stimuli, observing his spontaneous movement, making sure it's smooth and symmetrical. Always observe for lethargy, hypoactivity, irritability. A delay in spontaneous activity indicates brain damage, mental retardation, neuromuscular damage, or parental neglect. His cry should always be strong and lusty, suggesting normal cerebellar function. A high-pitched cry or a cat cry, a weak groaning cry, would indicate central nervous system damage. Social interactive response between the infant and parent is always observed. The infant should be smiling and babbling at parent and should recognize the parent at all times. This usually happens at 4 months, and then he will say mama at 9 months. Coordination is assessed by observing the muscle tone in the resting posture. He will favor a flexed position. His extremities should be symmetrical. His hips should be folded inward and slightly abducted, and his fists should be tightly flexed. After 2 months, flexion will give way to a gradual extension. If the baby is born after a breech delivery, always assess for the frog positioning, which means there's no flexion to the lower extremities. His extremities would be lying flat and in a frog-like position. Testing for spasticity by flexing the knees to the abdomen and then releasing quickly. They should unfold quickly, flexing the head gently forward and a quick extend and adduct of legs. Then occasionally they will scissor their legs. If he resists head flexion, this indicates cerebral palsy. At 3 months, the fists, which are normally held in a tight flexion, will start to release. Reaching for purposeful objects at 4 months, transferring object from hand to hand at 7 months, and a purposeful release of object at 10 months. If you note that the infant is less than a year and a half and still prefers to use one hand for everything, this is indicative of motor deficit on the opposite side. So if he tends to use this more, that means that there is a motor deficit to the opposite side. In the assessment, you will note the baby's head. If the baby's head is arched back and the neck is stiff with arm and leg extension, this is called opisthotonos. And this is indicative of meningeal or brainstem irritation. If you note only limb extension with one side, this indicates intracranial hemorrhage. If you note just upper limb asymmetry, this indicates a possible brachial plexus palsy. The head control is important to note the muscle tone, and this is checked by the baby lying supine, holding wrists, and pulling gentle. The baby's muscle tone is intact if he pulls up with you. You hold his wrist, pulling up gently to a sitting position. Baby will hold his head briefly and then flop forward. His head will flop forward. At 4 months, head will not flop. When you hold a newborn baby in the prone position, one hand holding his head at a 45-degree angle. His back will be slightly arched, elbows and knees will be flexed. At 3 months, the Landau reflex will be exhibited when the baby raises his head on his own, raises his head and arches his back, and then extends his arms. This is called the Landau reflex, and it's called the swan dive as well. The abnormality would be if you note that the baby's head lags or there is failure to hold head midline. This indicates early signs of brain damage. Unable to do the swan dive will result in head lag, limpy, floppy arms and legs. This is motor weakness or mental retardation. In doing the reflexes for the infant, infantile automatisms are the reflexes assessed during the screening examination by checking the infant's rooting, grasp, tonic neck, and Moro reflexes. The rooting reflex is part of the cranial nerve 5 assessment as well, and this is tested by brushing the infant's cheek near the mouth. You touch the infant's cheek and you will note that the infant's face will turn his head towards the side that is being brushed and will open his mouth. Normally this is done for the mother. This is done on the inner part of his mouth so that he can turn this way for feeding or for nursing. This reflex usually disappears at 3 to 4 months. The second part of the rooting reflex is the sucking reflex, and for this you have a gloved hand and you will touch with your gloved finger to the infant's lips and then offer the infant your finger and he will suck on your finger. You note if there's a strong sucking reflex. This reflex disappears at 10 to 12 months. Strong rooting and sucking reflex is also indicative of proper cerebellar function. In testing the palmar grasp, you will place your infant, his head midline to you, and this ensures that you get a symmetrical response. You offer your child the finger from the ulnar side, and you note the tight grasp of all the baby's finger around your finger. This reflex is strongest at 1 to 2 months, and it disappears completely at 3 to 4 months. A persistent, strong grasp after 4 months indicates frontal lobe lesion. An abnormal sign is an absent reflex indicating brain damage with local muscle or nerve injury. In testing the plantar grasp reflex, you touch your thumb at the ball of the baby's foot and you note as the baby curls his toes tightly around your finger. This reflex disappears at 8 to 10 months. The Babinski reflex is tested by stroking your finger up the lateral edge across the ball of the infant's foot, thus noticing a positive Babinski reflex. This reflex, you will be seeing the fanning of the baby's toes as you go towards the ball of his foot. This reflex disappears at 2 years. If it's still present at 2.5 years, this indicates a presence of pyramidal tract disease. In order to properly assess the tonic neck reflex, I will place the infant supine, whether the baby is awake and relaxed, or whether the baby is asleep. I will turn the head to one side. When you turn the head to one side, the chin lateral over the shoulder, you note the ipsilateral extension of the arm and leg, similar to that of the fencing position. One arm will be extended and the other one will flex up. One leg will extend and the other one will flex in, as if he's going to do fencing. You turn the infant's head to the opposite side of the initial position you placed him, and the same position will automatically reverse. So if he's turning this way, you're going to see it on this side, and then if you turn his head this way, this arm is going to curl and this one is going to be straight, and the legs will do the same thing, the opposite, direct opposite. This reflex appears at 2 to 3 months, and it decreases. You see it less and less from 3 to 4 months, and its disappearance is between 4 to 6 months. If it persists later in infancy, this is indicative of brain damage. The Neuro reflex is noted when you jar the crib or make a loud noise or you clap your hands. Basically what happens is you startle the infant. When you make a loud clapping sound, you startle the infant. It's easiest if mother is holding, or if you are holding the infant in a semi-sitting position. If you have him in a semi-sitting position and you quickly lower him, lowering him about 30 degrees, he's going to be startled. You're going to note the symmetric abduction and extension of limbs, both arms and legs. You're going to see the fanning of his fingers, and then they'll curl. The thumb will curl, and then it'll form similar to a C. And then he'll bring automatically his arms and legs inward, as if he's hugging a tree, both his legs and his arms at the same time. This reflex disappears at 1 to 4 months. The hyperactive response would indicate central nervous system infection or tetany. Absence of a Neuro reflex at birth, or if the response is present after 5 months, this is indicative also of severe central nervous system injury. Absence of movement to one extremity would indicate a fracture of the humerus or clavicle, with or without brachial nerve palsy. The placing reflex is assessed by holding the infant upright with your arms closed under his arms and close to a flat surface, letting the dorsal top of his foot touch the surface, noting the hip and knee flexion, and then following the hip flexion and extension to place completely his foot on the surface. This reflex is present 4 days after birth. Then you will note the infant taking alternative steps. This is the stepping reflex, and this reflex disappears before he voluntarily walks on his own. This concludes my part of the neuro assessment for the motor function, cerebellar and cerebrovascular and neuro reflexes. Thank you.